Nupur, if you are live, you can start.
Okay. Good evening, one and all. A very warm welcome to all the viewers who have joined us globally for this exclusive webinar organized by Cynodent. I would like to express my gratitude to Dr. Anmol Bagaria, founder and CEO of Cynodent, and the entire team for organizing this webinar. I am Dr. Nupur Gagrani, your host for the evening. I'm an endodontist by profession and practicing in Goregaon, Mumbai. I'm presently working as Maharashtra State Co-Head of Cynodent. My co-host for this session is Dr. Akshata Gupta, who is working as UP State Scientific Head of Cynodent. Now let me brief you about Cynodent. Cynodent is a unique international digital healthcare platform, first time in the world. It is a step to have global healthcare for all. Cynodent brings you Cynodent International and Cynodent India. It is a revolutionary change by bringing a digital healthcare platform that will provide and enhance a good relationship between patients and doctors. It also enables a real-time appointment scheduling system. Our goal is to create an easy and fast access to healthcare services. Cynodent is here to create precious and healthy smile on our patients' faces, always with minimum effort and maximum welfare. Cynodent International has brought research cell, blog section, and educational programs for doctors to enhance their knowledge, skills, and keep them updated regarding the recent advances and latest treatment developments. We are currently doing free webinars for students, dentists, senior practitioners from India, as well as across the globe, which are different from the webinar era going on. We also design papers, mock tests, and send latest textbooks to the budding students. We are trying to bring globally historic changes by uplifting our honorable profession more and more every day. We are working for social welfare and humanity to enhance the quality of life by providing healthcare needs, health awareness, and free treatments. Now, coming for today's webinar, I heartily welcome Dr. Ritika Arora ma'am on board. And the topic for today is Introduction of Facial Aesthetics, Botulinum Toxin, Derma Fillers, and Platelet-Rich Fibrin in Dentistry. Ma'am, it's my immense pleasure to be hosting you. Ritika ma'am has completed her bachelor's in dental surgery from Delhi and master's in periodontics and oral implantology from D.Y. Patil Dental College and Hospital, Navi Mumbai. She is presently working as professor and head of department in the Department of Periodontics, Vedic Dental College and Research Center, Daman. She is also working as a consultant periodontist in various clinics all over Mumbai. A successful career in cosmetic dentistry led her into the world of facial aesthetics in 2013. Being a dentist by profession, she had an aesthetic eye well suited to evaluate the symmetry and aesthetics of facial expressions. Since then, she extended her knowledge in this field by completing courses in skin laser therapy and aesthetic medicine from Hong Kong. She is presently practicing as an experienced facial esthetician, carrying out facial rejuvenation involving botulinum toxins and derma fillers. She also conducts lectures and workshops on facial aesthetics on regular basis. It's fascinating that how simple and subtle changes to smooth and relax muscles can freshen a face to look younger. So now it's time to think outside the mouth. It's time to take cosmetic dentistry to the next level by introducing the concept of complete dentofacial aesthetics. It's a pleasure, ma'am, to connect with you. I would request you to please start with your presentation. Thank you.
A very good evening to all of you, and thank you so much for giving me this opportunity. This is my first time with Cynodent, and I'm looking forward for this webinar and many more associations ahead. So I think let's not waste time. Let's go ahead. I'll just start the screen share. Okay, are you able to see my screen?
Yes, ma'am,
Yes,
you're
ma'am.
visible and audible both.
Okay. Just give me a second till the time. Okay, so as already the introduction has been given, I am basically a periodontist by profession, but it was just luck by chance that I was introduced to this field of facial aesthetics. And it's been almost now, I would say, more than 8-9 years that I'm into this field. And it's been a long journey, but it's going well. So just to give you a brief introduction, this is my, I practice in a place called Bandra for those who are from Mumbai, and those who are from abroad. In this place is in the heart of the suburbs of Mumbai, India. So this is my practice. I do a lot of cosmetic dentistry. I do a lot of implants, but what added value or the which gives me the extra edge is facial aesthetics. So I have a skin cum dental practice. This is my short tour of the clinic. Okay, so as all of you can see that this is how my practice looks like. My journey in facial aesthetics started somewhere way back in 2003. And since then, there is no looking back. Just give me a second. Okay, sorry about that. So this has been my journey since 2016 so far. I have been running courses not only in Mumbai, but all over India, as well as I've been a speaker internationally. Um, Obviously, my focus has always been on facial aesthetics. Whenever you want to go. So that's how the journey has been so far. For some reason, my screen is hanging. Okay, let's get back to the topic. So today's topic is more going to be on botulinum toxin, derma fillers, and dentistry. When I started lecturing, a lot of people used to ask me that what has facial rejuvenation and dentistry got to do together? Are you serious? What are we as dentists going to do about this topic together? So we all know when we get into a dental college, traditional dentistry is all about treating teeth and gums. And I'm talking from way back from the last 50 years, I would say. Then, as we all know, the biggest craze from the last 15 years is cosmetic dentistry. Now that we have seen all the various phases of dentistry, starting from teeth whitening, laminates, veneers, implants, lasers, some of us wonder, that what is it that something different that I can do as a dentist? A lot of us tend to change a field, go into something like medical legal, some go into MBAs, but there are a lot of us who want to remain in dentistry, but do something different, get the different change. So I would say that it's time to think outside the mouth. Why do I say that? Now, you buy a nice painting and you go to an artist shop, you buy a nice painting, he'll roll the painting and give it to you. What will you do with that painting? You would want to get it framed. Even if you have won a nice award or a certificate, the certificate only looks good when you frame it. Similarly, I would say face is the frame of your smile. The aesthetic of the smile, it involves just more than the teeth. Cosmetic dental material placed by an artistic operator can give you that movie star look. But what about the frames around the smile? The perioral tissues are the areas that contribute in making the people look older than they would actually look like. So when we do a case of smile designing, so all of you who have been into cosmetic dentistry, we all know that when we talk about smile designing, does it mean that you just assess the teeth, or we also assess the facial structure, lip movement, hair color, skin tone, tooth size, and then craft a smile that reflects the individual beauty and personality, which is what makes a smile or a smile designing better. So I would say that when you look at a middle-aged woman with beautiful veneers but thin colorless lip, that is what tends to hamper the cosmetic effect. Let's pioneer. So why don't we pioneer a new approach, which is a complete dentofacial aesthetic approach? What happens to you when a patient walks into your practice? As a dentist, your focus is, okay, she's got yellow teeth, she's got square teeth, she's got gaps between the teeth, and maybe I can suggest a teeth whitening, maybe I can suggest a smile designing. But what does the patient do? When you give the patient the mirror in their hand, the first thing they would adjust their hair, they would look at their face, see how they're looking in the mirror, and then they will start talking about the teeth. So it is simple that it's not only the smile, but it's how the smile goes well with the face. Now, the same smile, there's a picture 1 and there's a picture 2. Now, in the picture 2, if you see simple things like just enhancing a little bit of the lips, getting these wrinkles out, this is just adding more value to the smile. So let's pioneer a new approach, which is a complete dentofacial aesthetic approach. Most of you would ask me this question, that why as a dentist should I offer Botox or fillers, or for that matter, I would be talking about PRF as well and its applications in dentistry. Firstly, as a dentist, we have the maximum knowledge of the facial and the dental proportions for optimal results. That is something as a smile designing, cosmetic, or an aesthetic dentist that we all learn. The second thing is, let me take you back to first year. All of us, when we attended our anatomy classes, we could not pass our first year without knowing about the facial muscles of expression. That means nobody other than us, like the people who were doing dentistry, had the maximum knowledge when it came to the muscles of facial expression. As in, our training has been maximum as compared to another healthcare professional, leaving aside, I would say, a plastic surgeon or as a maxillofacial surgeon, they tend to go a little bit more in detail. Then coming to the next point, whenever we want to get something new in a practice, a question comes that what is the investment that I'm looking for? In Botox and fillers, there is no investment, there is no equipment. Yes, obviously, you do need the proper training. The training might come to you at a cost, but that happens with any new field you start with. It all takes buying the product which you're going to deliver. The whole procedure. So when we think today about, okay, let's say that we have to do a dental implant. Now, when we have to do a dental implant, the dental implant at times might take you more than half an hour to 1 hour. The planning, the number of sittings, and trust me, the amount of money that you earn after doing a dental implant is probably the same money you could earn by doing a Botox or a derma fillers, which would just take 15 to 20 minutes. Last but not the least, or rather I would say before I go to the next point, the most important thing is the dentists are highly experienced with injections. Now, when I say that, if nothing else, when you pass out of dental school, one thing which you are the most confident, which you could even get up from your sleep and immediately give, is somebody asks you to inject LA and you can do that. Because you are so used to handling injections. Like I like to give you an example in this, with no offense to all my dermatologist friends who I have learned with, and all, with all due respect to them, dermatology is a field of study of skin and venereal diseases in India. It does not involve cosmetic dermatology as well. The way we learn about cosmetic dentistry later, so do they learn about cosmetic dermatology later. So their field does not really, as a dermatologist, involve giving injections. I still remember my first training, and I was the only dentist, and there were a lot of dermatologists with me. And trust me, the way I was holding the syringe and the confidence I had, at least in giving my first injection, was way higher, because I could see it was more like them. For them, it was holding the syringe for the first time in the hand after a long break. It was something like what I experienced in my third year when I was first asked to give a block or an infill. So that way, it gives us an edge as far as giving injections is concerned. It is not a problem with us. And I said, last but not the least, these procedures are done best on dental chair. Leaving aside all dermatological procedures, but this involving botulinum toxin and derma fillers is something we can do best when done on a dental chair. Why? Because it involves a lot of assessment. It involves in comparing the two halves of the face. It involves in comparing the three halves of the face, the five halves, seeing which side is deficient, which side we need to add more, less. So these procedures are done best on a dental chair. Okay, moving ahead. We often hear about Botox and derma fillers. Now, let me clear this part up. Botox is a trade name. Like, it's how it is marketed as Botox, but it is actually a toxin. It is known as botulinum toxin. Why we mostly refer all the toxins as Botox is the reason being, it was the first brand that came into India. So, for example, if you have to give a combination of amoxicillin with clavulanic acid, most of the time the salt that comes to your mind is Augmentin, because Augmentin is the most common one. So similarly, botulinum toxin, the most famous brand in botulinum toxin is Botox. So it is referred as Botox with most of the people. Fillers is what we normally call it as derma fillers as well. So a lot of people think both of them are either the same thing or they go hand in hand. Now I would like you to concentrate on this picture to understand. So first, before I go on to the applications of botulinum toxin, I would want you to understand what this botulinum toxin is. Now, when you look at these two pictures, the first picture is a picture of Amir Khan when we all know he had just come new in his movie, probably one of those Raja Hindustani. And this is a picture of him at a much later stage. What we see is that when in the first pictures, when he's smiling, you can see a few wrinkles on his forehead. So what is happening? His facial muscle expressions are in action. That means whenever he's smiling, his muscles are acting. In the second picture, there is a subtle smile on his face, but we can see a line on his forehead. That means he's not making any facial expression, but we yet see a line. This is the line which I'm talking about. So basically, what does Botox do? It acts at the level of the muscle. Wrinkles in motion caused by repetitive creasing and folding of the skin. These are known as dynamic lines. So these lines, which are caused by his smiling or by making frowning or by squeezing your eyes in, the lines which are created by those muscles, these are known as dynamic lines. But as we grow older, there are certain lines which still exist in our skin. These are known as wrinkles at rest. So it's like you're sitting, but you can still see lines on your face. These are known as static lines, which the crush damage is referred to as, which cannot be removed with the help of botulinum toxin, for which we require derma fillers, and that's what they do. They replace the lost volume. So repeating again once more, botulinum toxin basically acts at the level of the muscle. So it controls the muscle activity in nutshell. Derma fillers is completely different. It has no relation when it comes to the muscles. It basically adds volume. All the wrinkles, all the shrinking that has happened on your skin, it hydrates that and it removes all the, it adds volume to wherever there has been a loss of volume. So usually where derma fillers come into play is that, now this is a slide which is a selling point to most of my patients, that starting from the mid-20s, we all lose collagen. And we know that we all keep saying, oh, we are getting old. Now we are in the 30s, we are getting old. Now we are in the 40s, we are even getting older. So what really starts happening? We all start losing collagen. Along with the loss of collagen, there is also a loss of elastin fibers. Now, as a dentist, all of us know what collagen is, what elastin is. Now, elastin means the skin will become looser or unravel. It will lose its elasticity. Also, the other thing that happens is there is a loss of hyaluronic acid. That means there is less water retention in the skin. So it increases the visibility of lines and wrinkles. It is comparing it to a simple orange. You keep an orange outside for too long, it starts looking wrinkled. When you store it in the fridge, it looks nice and fresh. Why? Because the moisture of the fridge helps to keep it hydrated. Why do people say drink a lot of water? It's very good for your skin. Because your skin remains hydrated. When it absorbs water, it reduces the visibility of lines and wrinkles. Okay, so the question comes, is botulinum toxin, or commonly known as Botox, only used for wrinkles and anti-aging? So as a dentist, you must be thinking, oh, what is my job? I don't want to get into anti-aging dentistry, or I don't want to get into anti-aging skin. Let's talk how it can help in dentistry. And for that, we need to understand a little more about this toxin. So commonly, worldwide, this is the most famous brand of botulinum toxin or Botox, as I had told you. If you look closely, it says 100 vials. The Botox actually comes like a vial. How you have a vial of, you could say, antibiotic or something, which needs to be diluted with normal saline to get the liquid to inject. Now, when I say vials, it comes in units. So when we talk about Botox, we don't talk about ml. We talk about units. The other brands which are quite famous in the world are Dysport and Gutmann. Now, these are all international US, European brands. You get like Noble Biocare is probably the gold standard in dental implants. So is Botox. But the way you have Israeli implants, Chinese, Korean, Indian, so do you get these as well from other parts of the world now. Let's go into a little detail. Let me take you back from anatomy to physiology now. We all know, so what does Botox do or botulinum toxin do? It is basically a muscle relaxant. Now, we all know that when a skeletal muscle has to contract, there has to be a release of something called a neurotransmitter, which is your acetylcholine. That means acetylcholine will be released, the skeletal muscle will contract. What does it do? This is absorbed by the nerve root, which supplies the overactive muscle. The signal is blocked and there is no release of acetylcholine. If there is no release of acetylcholine, that means the muscle will not contract. If the muscle does not contract, that means the muscle will remain in the relaxed form. As in, if I don't want my patient to frown, which are the frowning muscles? The forehead muscles. If I block those muscles, the muscles will not contract and there will be no frowning. We will go more into detail as we go ahead. What happens when the effect of Botox wears off? Once the effect of Botox wears off, there is a new contact point eventually. So we all know these small axons keep growing. As they keep growing, they will form a new contact point or a new neuromuscular junction. That neuromuscular junction, they will form a new contact for releasing of acetylcholine. That means the wrinkle will return and now it is time for retreatment. So this is what really happens when we talk about Botox or botulinum toxin. So the effect is not permanent. How long the effect lasts? It takes about 7 to 10 days to see the results after the first treatment. The first treatment effects will wear off, maybe they would last up to 3 months. Subsequent, eventually they may last up to 4 to 6 months. So this is in short, I've not really gone into detail, just to explain you how the muscle relaxant works in terms of botulinum toxin. Now, just for the purpose of understanding, let me divide the application of Botox into dental applications or facial aesthetic applications. Now, when we talk about dental applications, I have divided them into aesthetics or therapeutic. And then we have obviously the facial aesthetics. Anybody who gets into the field of botulinum toxin or Botox or fillers is first taught this. because this is what got an FDA approval. It's again, I often like to compare a lot of things to dentistry because it makes it easier for you to understand. It's more like, okay, this X implant is FDA approved, but it does not mean the rest of the implants we are not using. Half of the implants in our practice which we use are not FDA approved. So the lot of applications related to facial aesthetics were FDA approved. So this particular part, applications of Botox, became more and more common, and their dental applications eventually followed. Okay, the most common dental applications for botulinum toxin is a gummy smile. Now, I am a periodontist. I still remember when I had finished my perio, PG, I was often called and said, okay, I have a patient with gummy smile. What can you do? What is a gummy smile? Anything more than 3 mm of gingival display on smiling. So why am I specifying on smiling? Because we all know there are two types of gummy smile. One gummy smile because of a short lip, and one gummy smile is because when the patient smiles, the lip gets elevated. So here I'm talking about the elevators of the lip, which are pulling the lip on smiling. If a patient has a short upper lip, even if the patient is smiling, if not smiling, the gummy smile still be there. That means Botox has no role to play. It will only play a role in a gummy smile, which is there, a true gummy smile, which we call more than 3 mm of gingival display on smiling. Okay. So now what happens on smiling? We all know that there are 3 muscles which are involved, which are known as elevators of the lips. Again, taking you back to basic anatomy, that we have 3 elevators. Elevator labii superioris elecnasi, labia superioris, and zygomaticus minus. Now, they all 3 meet at a point. That point, one of the guys named it as an Yonsoi point. And with a lot of research done, they realized if we control the elevators of the lip, we can control the gummy smile. That means any patient having more than 3 mm of gingival display, if we give at 2 points, 2 units to 3 units, and the effects would last for 3 months. So the rule of 3 to 3 came. That means where all the 3 elevators meet, if we inject that point, which is the point is 1 centimeter from the ala of the nose, we are controlling the elevators. So even if the patient wants to smile, the patient is trying to smile, but the lip is not getting lifted up. So that is how the gummy smile works. The second application is, which I call it an aesthetic as well as a therapeutic application, is the mentalis muscle. We often see this kind of thing, wrinkling. A lot of us see it in orthodontic patients, hyperactivity of the chin, of the mentalis muscle. We often see it in patients who are much older. Now, what does this hyperactivity do? Mentalis muscle, it causes wrinkling and creasing of the skin. At times, there can be an orthodontic relapse that can happen due to this hyperactivity. So the other application is to inject the mentalis muscle to get away from the wrinkling and give a smooth, non-creasy skin. Another muscle as a dentist, which we all know is very, very important, is the masseter muscle. With so much about being talked about, full mouth courses, TMJ courses, we all know that there is a muscle which plays an important role in chewing, clenching, which is the masseter muscle. Now, the aesthetic application is if you have a hypertrophy due to a masseter muscle, your face would look very square. So next time you come across from people from the eastern side of India, you would often find their faces very square. The squarish face can be narrowed down due to the masseteric hypertrophy if it is there with the help of Botox injection. The second application of the masseter muscle, which we often call it, is the clenching of the teeth, the grinding of the teeth, or bruxism. Now we all know night as a dentist, what would you do? You would give a night guard. But we all know that a night guard is just to protect the teeth. It's going to affect it's not going to affect the masseter muscle. Now, what happens in bruxism or teeth grinding? The patient is involuntary grinding their teeth. The masseter muscle is working involuntary. Why it is working? Obviously, we need to go into the root of that. There are a lot of, that's a very big and a controversial topic, sleep studies, TMJ study, this, that. But as a dentist, half a part you play by giving a night guard. But the other half part you can play is that if you see that there is often too much hypertrophy of the muscle, that means you will find often a bulk at their angle of the mandible, and that which has happened due to the hypertrophy of the masseter muscle. So along with the night guards, at least you will be able to control the hypertrophic masseter muscle from contracting involuntary. Immediate loading of dental implants. Now we are all talking about from no teeth to teeth in 72 hours, immediate loading. We want, patients are looking for fixed solution. What is the biggest fear in immediate implants? That once I load, even if I give the patients the proper bite, even if I give the patient the instructions, don't eat hard food, still the osseointegration is going to take its time. So the newer concept nowadays, a lot of times, is to adjunct this therapy to reduce the stress on the new implants, to get a better osseointegration, is to give injections in the masseter muscle. Another application of the masseter muscle, denture patients. We all know that when we are making dentures for the patients who have lost all the teeth, we say there is a loss of vertical dimension. Why is the loss of vertical dimension there? The loss of vertical dimension is there because the muscles are in a contracted form. The masseter muscle has contracted. Now, a lot of times you give the best of denture to the patient, but the patient will still find it difficult to adjust. Why does that happen? That often happens is because of the strong and irregular contraction of the masseter muscle, which interfere in the snug fit of the denture, which leads to the patient being uncomfortable. So again, for a period of 3 months, till the patient gets comfortable, we can do injections for the masseter muscle. Okay. TMD. Now, this is again a topic which is gaining a lot of popularity. Temporomandibular joint disorders and temporomandibular joint pains. This is something, migraines, which is again being talked a lot about. Let's talk about the science behind these temporomandibular disorders. Now, there are 3 things. Either we have a muscle, there are 2 muscles, temporalis muscle and masseter muscle, or there is a joint. Now, if there is a TMD disorder or a TMJ disorder, if it's a joint, we all know that we have to treat the joint. But a lot of times, it's the fault of the muscle. Now, it can be a temporalis muscle or a masseter muscle. And these often may lead to clenching, grinding, chronic headaches, migraines. And a study was done way back in 2013, which is still talking about 8 years ago, that there were 116 million Americans who had suffered from jaw-related problems, and 73% who were treated with the help of Botox. Why Botox would be helpful in this is because of the temporalis muscle or the masseter muscle being injected both together. They saw an improvement, though the improvement lasted only for 3 months, but they did see an improvement. So again, Botox is something, or botulinum toxin is something which is used as an adjunctive therapy to whatever the rest of your treatment is being done. So till now, I was talking as a dentist. Now that you have gained confidence that you have applications in dentistry, you could convince or applicate your patients as far as dentist application is concerned. Let's come to the facial aesthetic applications. So the facial aesthetic applications, the most common one, the most approved one, the FDA approved one is the frown lines, the forehead lines, or the lines around the eyes, which are also known as the crow's feet. So these are the most common one which are being treated worldwide for botulinum toxin or Botox. Okay. So this was a small introduction to botulinum toxin and just about Botox. Now let's move on to derma fillers. Like I had started about botulinum toxin, the same thing I would like to say. Is derma fillers meant only for aging skin? No, let's see how. Now, what most of the derma fillers which we have in India are made up of something which is known as hyaluronic acid. Now, we all know hyaluronic acid is a naturally occurring gel which is found in our eyes and joints. The same gel is made into the laboratory, copy of the same naturally occurring type. It has no animal or human source. So how does it work? It's like a fancy jelly. You place it under the defect and the area of the wrinkle or the loss of volume, and you see immediate results. So this is the main difference between Botox and derma fillers. It's a fancy jelly. You place it where there is a wrinkle or a volume loss. So when I talk about a wrinkle, I'm not talking about a wrinkle or a crease which is happening due to the muscle activity. So this muscle activity does not have any role to play when it comes to the fillers. We are just talking about filler, as the word says, just filling a defect. So we see immediate results. How long the results last? Where the fillers last, Botox used to last only for 3 months, but the fillers last up to 6 months to a year. Nowadays, the fillers even last up to 1.5 years, as the company says it. What happens to the filler? The filler would break down and it's time for another session. So just remember, we're talking about hyaluronic acid fillers. They are biodegradable. They will be broken down by the body and cleared by the system. So it gets just dissolved. It's HA, it breaks down into water and it's removed. These are the various brands. So fillers, we talk in terms of ml. It comes as a 1 ml syringe. The syringe looks quite like a cartridge. You will see a couple of videos ahead. Remember, Botox, we talk in terms of units. So Botox is very different. I will explain what we mean by units as we go ahead. But fillers, they come in syringes. The most common applications of filler as a dentist, what you would probably like to look at is improving the appearance around the mouth, which is with the help of your nasolabial folds, maybe sometimes reverse smiles, the wrinkling. Now, this is a very, very important and a common example. Now, often this is what explains you the perfect difference between a Botox and a fillers, what we call as the perioral lines. Now, if you look at this lady at rest, she has lines which are these vertical lines which are visible. Now, these lines are there at rest even, but also we know a lot of old ladies have a puckering habit. That means they will not realize, but their involuntary, their orbicularis oris muscle will keep working. So in such a case, we would not only do Botox, but we will do fillers also. Why? The Botox will control the orbicularis oris muscle, whereas the filler would fill these superficial lines. So this is a perfect example of using Botox and fillers together. And obviously, we know it is also used for cheek enhancement. Last but not the least, as a facial esthetician and as a dentist, lips. With social media, Instagram, selfies, people are so very conscious about the lips. And who better than a dentist would know the anatomy of the lips, the Cupid's bow, the 1 to 1 0.6 ratio, the lip volume, uh, and everything related to the lips. So this is what derma fillers can do. So this is, so it does not have to be an overdone. It can be a subtle enhancement as well. One of the intraoral uses of derma fillers, which is becoming very, very common, is the use of both black triangles. Now, as an aesthetic dentist, what would you do? You would land up giving a long contact point and compromise on the aesthetics. But today, there are a lot of research papers, there are a lot of studies done by a lot of PG students where they are using derma fillers to fill these black triangles as well. Okay, since we are talking about facial aesthetics, and I do a lot of facial aesthetics with Botox and derma fillers, but as a dentist, I also use a lot of PRF in my practice, that is platelet rich fibrin. And I would like to run, because I'm talking about facial aesthetics. So I usually add this topic, which is a quicker topic. So we used to hear everybody as a dentist over here would have heard about PRP, which we normally hear a lot related to implants. But PRP has been a very old, it was an invention of the 1990s, where it was also used in orthopedic, pediatric, ophthalmic, as well as for hair and skin rejuvenation. So if you ask a plastic or a dermatologist, they still believe a lot of into PRP for skin and hair loss. So it's not something which as a dentist it's common, it is also common for other fields. So PRP was the first generation of blood derivatives. It stands for platelet rich plasma. But today, as a dentist, we are using PRF, which is the second generation. And as a dentist, you would probably use it for making these membranes. And these are its applications in dentistry, starting from dental implants to socket preservations to recessions to GBR and everything. And for making sticky bones. So, but along with that, there is something which is very, very common in the outside world, which is called a vampire facelift, which gained its popularity with the help of PRP. So when the first generation of blood derivatives was used, the PRP, they used to call it the vampire facelift. We obviously, or I would say I obviously use it with the help of PRF. So PRP is platelet rich plasma, and this is platelet rich fibrin. The difference is this has more of growth factors. It is the second generation, so it is even better. So this is how your face would look after a vampire facelift. I'm just taking you through a few videos to show you how PRP and PRF is done. So we have removed the liquid, and this is a micro needling pen, and we are just using a micro needling pen. So I often use this for doing hair rejuvenation. Okay, so this was, let me go on to the next one. This is a video that was for hair rejuvenation. This is for skin rejuvenation. Collect the blood. This is a centrifuge machine. There are certain protocols which are unique to every field. Remove the PRF liquid, the golden liquid, which is called. So this is a micro needling. It is often used for facial rejuvenation, for acne scarring, or in general to improve the quality of the So it's a fairly simple procedure. We are just using a micro needling pen, and we're using insulin syringes. So I often call it the success in the blood. Okay. Let me share some of, let's get back to some of the cases. So I have spoken about, so this is how a few cases I would like to show. Young patient, if you see his hair in general is okay, but often a lot of men are now conscious about the hair of smaller areas showing off as bald. Now, this was one of the cases, and within a few sessions, say just after 3 sessions and after 3 months, it takes some time. PRF takes a little bit of its time to show results, but you get fantastic results. And as I said, we are still talking about the second generation of blood derivatives, but the dermats are still using the first generation and getting excellent results. This is another case done way back in 2017. So if you see, I have been doing cases from 2017, and still we are able to see good results. This was okay. Now this is a case, as I said, when we talk about dentofacial aesthetics. So the guy came to me. So I have a usual run of the everybody, I have a dental practice. The guy came to me saying that I want a good smile, and he came to me for a smile design, which typically with veneers. And so this is how I go about, most of my patients who come to me do not come to me for facial aesthetics. Now, yes, in the beginning, they used to come to me for dentistry, and I used to cross sell. So when I was speaking to him and I said, is there anything else that you would like to improve? And he said, yes, what he said, which a lot of patients complain, is that I look very tired. Or at times they say I look very angry. And this picture, since being a collage, it's not very clear. but I'm sorry about that. So he said, I do have a lot of wrinkling on my forehead and my eyes look a bit tired. So can you do something about it? I said yes. So I worked not only on his teeth, but if we had to hide his eyes or the upper face, yes, the teeth would have looked nice in itself. But working in a complete dentofacial aesthetic zone, we could give him a much better improvement with the help of working with Botox and derma fillers. Now, this is a case, if you see, this girl has very good lips, nice form, shape, function, but she said, I want a little more enhancement. I don't want them to look artificial, but yes, I like them to be a little more enhanced rather than just using cosmetic products. So what you need to tell your patients, it's not only always that you would land up having those pouty Russian lips, you can even get subtle enhancement. Similar case like this, and this is an immediate before and after. She said, I have thin lips, but you see these marks, they are immediately after the fillers were done. So this is the before, this is the after. This was one of my first cases, which I had done with Botox and fillers. You will see the video also of it. She was not the ideal case. And today I would probably not even touch a case like this. But yes, I would want you to concentrate on her lower part of the face, which is this. Now, she came to me saying that, so she was my dental patient, and she said that whenever I smile, the lipstick goes onto my teeth. Okay. If you imagine, that is a problem with a lot of older patients because of the thinning of the lips. Even if they put the lipstick, there is no enhanced marking. That means the patient cannot have a perfect lip line. She said, that's one of my problems. Secondly, she said, I don't like these lines and I don't like these sagging skin. Now, she, as I'm mentioning again, is not an ideal patient for Botox or fillers. She would probably need a facelift. She would get better results with threads. But she had heard about Botox and fillers, and she said, can you do something with me to show immediate results? I have a granddaughter whose engagement party I have to go. So I don't want to look her age. I don't want to look my daughter's age, but I want to look a couple of years younger. I said, okay. So this is her pre, this is her post. I worked on the full face. You will see results first. So I removed these lines which are there. I made them more subtle. I worked on her lips, just gave her not pouty lips, but I defined them. I tried to reduce the lines, not take them exactly away, but yet make them better. Try to give this a more better shape. And if you see her side look at this fold versus this fold. Look at this fold versus this fold. Look at this area versus this area. So there were no lines over here. There were subtle improvements I worked on. Obviously, I did a little bit of Botox for a forehead. I worked on her under eye as well. I worked on her nose as well. This is a side face. So see, I have tried to give her a sharper nose, which was not there. The fold, these are the folds which were I have worked on. This has become better. Mainly her lips have become better. So it is not about giving them. So a lot of people think they become plastic, but no. So this is a video which is telling you about the various areas that I have injected. If you see, that the syringe looks like a syringe that you would use in dental with the help of a cartridge for lidocaine injections. So working on different areas of the face. So obviously this is a little more advanced as a beginner to work, but yes, as you learn this technique. So what I want to show you in this technique is that it's all injections. Once you know where to inject, once you're trained into which areas to inject, doing the procedure is not so difficult. Learning and diagnosing how to place the injections, where to place the injections is important. Okay, another case. This guy had come for a jaw correction surgery to me and for some dental implants. Obviously, we worked on his jaw correction much later. But he also said he was not very happy with his chin. He was not, cheeks. He was not very happy with his forehead. Again, somebody whom I worked with a combination of Botox and fillers. And his jaw also looks better just by clearing his forehead and just by clearing his cheeks. Young guy, very, very young guy. He's got braces in his mouth. So if you feel patients are not conscious, that nowadays they are. He comes and tells me that I look very tired. I don't have very pleasing eyes. Can you do something or work something from my eyes? Now, if you see, there is so much of a difference in his eyes in the before and after picture. Because he had hollowness, because he had shadows, his eyes used to look sunken. So just subtly working for his under eyes or cheeks, it made so much of a difference to his face. So see if you can appreciate this, that there is so much of a difference if you just work with derma fillers for the under eye. This was another patient. She's one of my regular patients who comes for my courses. And this was actually done by the students who had come for my course. Again, just to remove the mild wrinkling, just to remove the mild shadow which comes, worked on with the help of derma fillers. This is a before, so we worked on her lip as well, on these corners. She's actually a proper case for bruxism, and she's actually FMR case. So we did work for Botox also. So because it is a immediate before after, you don't see the Botox effect, but her eyes have been worked on. So there are various parts of the face, and this was all done by the participants of my course who had come. We worked a little bit on her chin as well. So again, a combination of Botox and derma fillers. One of my regular patients again, her problem was the frown, which was turning into static line, which you still see in this. So she said, I better start working. She said a simple thing. I want to treat my frown. I don't like my frown lines, but I don't want a plastic look. Tomorrow, when my children look at me, or if I want to look angry at my husband, I shall be able to. So it's a myth that Botox creates a plastic look. I subtly treat it so that even if she frowns, there is a little bit of expression left, but it does not create or does not deepen these lines. Again, an example of under eye filler. It works, under eye fillers work magic when it comes to all these following. Again, a case. So this is a typical example of a static line. These static lines are the ones which can be treated with derma fillers. So I've controlled the muscle movement, but these lines which have happened over a period of time due to constant use of this procerus muscle or the corrugators can only be corrected with derma fillers. The aspiring actor, very, very conscious, everything on camera gets enhanced. She was a typical case of massive hypertrophy. So I worked with her jawline with the help of Botox, reduced the bulk here. She was so conscious that she could see this deficiency, and we reduced this deficiency to give her a nice jawline again. So again, a combination of Botox and fillers. Yes, I did work on her lip also. She wanted a subtle enhancement of the upper lip, so we worked on that as well. Um, Very old case, again done by the participants. If you see, she's got a nice cupid's bow, nice shape of the lips, but she said, I want volume. I want my lips to look a little more fuller. This was a workshop I did in Bangalore, and this was done actually by the participants. And her nice lips still look nice even after doing the fillers. So you can keep the lips natural, you can keep them artificial. It entirely depends what your patient wants. This is one of my recent cases. The lady had come for a Hollywood smile. Now, I do a lot of facial aesthetics, and honestly, I don't like Hollywood smiles, but that is what she wanted. Along with doing this, which is my bread and butter, or which is our bread and butter in dentistry, I worked on her lips, I worked her on these lines, and she finished off like this with nice teeth and nice lips, which is a perfect example of a complete dentofacial aesthetic approach. One of the last videos to show you again how we work with the help of fillers, just to show you how. So if you see, it's the syringe says lidocaine in it. It helps to. So I'm just injecting her various parts of the face. This is for the nasolabial fold. So you need to know the technique, you need to know the points. Once you know that, it's quite simple. Inject, place the injection needle in the area, aspirate so that you're safe. This video is mainly to show you the ease of injections. Okay, so that's how I usually end my presentation by saying a smile does not end with beautiful teeth, nor should your trip to the dentist. And those are my details. I do run courses, as they had mentioned in the beginning. They are usually of 2 to 3 days, concentrating more on botulinum toxin and whatever you have seen in my presentation. That's what I train for. At the moment, I do want to have a course, but it would happen in the near future. Because of the COVID restrictions and everything, the problem is that I need volunteers. Unlike in dentistry, where you can work on models and stuff, here I can't do that. I do need volunteers, and they are not really, they're still not very comfortable in coming. So let's see. Hopefully, we should have a course somewhere planned in the month of say September, or maybe in the month of October or September, once things are better, and hope we are able to get back to life very soon. So I'll pass the mic over back to them, to the organizers.
Thank you, ma'am, for such a wonderful presentation. With your permission, I would like to head on to the question answer session.
Yeah, please go ahead.
Ma'am, the first question we have, and it is a very common question, are there any side effects of Botox and dermal fillers?
So the side effects are not there. Both, it's only that you could probably go wrong a little bit in your injections. But yes, once you know the anatomy and everything, they are very, very safe. Trust me, they are done even in routine, what I would say now, routine small clinics as well. So they are absolutely safe, and there should be no problem when it comes to Botox or derma fillers.
Are there any contradictions for Botox and fillers?
No, so I wouldn't say there are any contradictions as such, unless when it comes to Botox, unless somebody is allergic to albumin or something. Fillers, not really. Even patients with blood thinners can get fillers done. It's just that we need to make sure that we tell them that you might have a little bit of bruising. So that is what they need to be a little careful about.
Ma'am, what are the post-procedure instructions for the patients of Botox and fillers? Anything specific?
So there are like they need to not rub the face. In terms of Botox, they do not need to exercise or lie down for a couple of hours. So every procedure has a few this thing, but nothing that would restrict their day-to-day life.
Is there any age at which you recommend to get Botox and fillers done?
Trust me, I get patients today, even at the age of 25. If you've seen all those people, there were a lot of young patients who had come, and they have been, very, very happy. So starting from as young as maybe, say, 20, 25, they have been getting these procedures done. So there's no really an age. You can even, lip filler is something which nowadays even a 22-year or a 24-year-old girl comes to get done.
Ma'am, what do you prefer for facial rejuvenation, PRP or PRF?
I prefer PRF because it is the newer generation of blood derivatives, and I have seen very good results with it. So I do prefer using the PRF.
And ma'am, the last question for today we have is how to decide whether facial aesthetic treatment would be fine or periodontal surgical procedure would be fine to treat gummy smile. I mean, what is the deciding factor for it?
Okay, deciding factor is, so where if a gummy smile can be corrected with a dental perioplastic procedure like So we know there are two types of gummy smile. One is due to excessive gingival overgrowth, where we can do a crown lengthening or a gingivectomy. But in spite of that, if the gummy smile persists and the patient does not have a short upper lip, and the patient still wants a better smile, then go ahead with Botox. At least the effect would last for 3-4 months. But then once the patient gets addicted to it, they would want to come back again and again to get it treated.
Thank you so much, ma'am, for your valuable time today. I would
Thank you so much.
I would like to thank my co-host, Dr. Nupur ma'am, and Dr. Anmol Bagaria ma'am, founder and CEO Cynodent, for organizing, and Team Cynodent for organizing this wonderful session. Now I would like Dr. Anmol ma'am to please conclude the session.
Good evening, everyone who are present globally with us and viewing us live now. I hope you are enjoying the learning experience with us. I would thank ma'am for giving us her valuable time this evening and enhancing our knowledge and skills today. Thank you, ma'am, for giving your valuable time and such an informative
It
webinar.
was a great pleasure being a part of Cynodent. And yes, all the people who were listening to this webinar, you can go ahead and get in touch with the Cynodent team. As and when those who are interested in joining a course, they could all contact you, or my contact details are there. And hopefully in future, we will keep having some more further detailed webinars on this topic if it's in demand.
Surely, ma'am. Ma'am, should I end the session for today?
Yes. Thank you so much once again. Thank you.